20 years ago or so, maybe 30 years, when a lot of the techniques that we have now, they didn't exist. So a lot of people, they go online and they research hip replacement and they just see the horror stories. Oh my God, you're getting blood clots, or it's a huge incision. We worry about the hip popping out of socket. You can't do certain positions. And that's really obsolete nowadays. Our newer techniques have really improved on the old procedures. The parts last longer. So the way we do the hip replacement now is a small incision in the front of the hip. We don't have to cut any muscles or tendons that way. The old way of doing this, you went through the side or the back and you detach things. Well, the hip needs those things to keep the ball in the socket. The muscles kind of hold it in place. So in those old procedures, you had a month or two where you couldn't cross your legs, you couldn't bend over at the waist because you're worried about the hip popping out of socket. By altering our techniques and doing it from the front, we don't cut those muscles, so the hip is inherently extremely stable. So we don't have any restrictions afterwards. We get you up walking much quicker. So the risk of dislocation is pretty much zero now. The risk of infection or blood clots they're less than 0.5% at our facility. So we've really done all we could to mitigate those things, and it's really a very rewarding procedure.